Welcome to LUVO Lounge. I'm Mary, master esthetician and clinical trainer. I spend most of my weeks working with practices, helping them strategize and get the best outcomes for great skin.
And I'm Sarah Jane Fitzpatrick, and most people call me SJ, and I'm the Director of Education and International Training here at LUVO. I am a global educator, and I did help develop the Bela MD protocol and work really closely with clinics around the world to help deliver real, lasting results, not just those quick wins.
And today we're talking about something that honestly doesn't really get a lot of attention.
And that's the foundation of healthy skin.
Because everyone talks about lasers, lights, RF microneedling, but there's lots more to be said about serum facials.
Exactly. And if the skin isn't properly prepared, even the most advanced treatments are never going to deliver their full potential.
Exactly. So that's what we're diving into today.
The Bela Foundation, how we prep, protect, and optimize the skin before we layer on correction. The industry is shifting in a big way towards these non-invasive treatments, right? Patients today want results, but they want that without downtime, risk, or disruption to their daily lives. So we are seeing this massive growth in this space, valued at over $68 billion and projected to exceed $170 billion by 2030. That tells us this isn't a trend. It's the future of aesthetics.
And patients are more educated than ever, right? They're looking for treatments that not only are effective, but safe, efficacious, supportive for long-term skin results.
So this isn't just where we see the industry going. This is where it already is. And that's where Bela MD really stands apart. This isn't just another facial. It's a comprehensive skin health platform designed to prep, to hydrate, maintain, and enhance results across multiple treatments. So everything about this protocol was built intentionally, right? Every step, every technology, every ingredient, really working together to optimize outcomes. So this isn't a facial, it's a system for better results. So we start with diamond microdermabrasion, and this is where we reset the skin. So we're removing the outermost layers of the skin, we're disrupting the barrier, and we're creating this ideal environment for everything that follows.
And this is where we really create the foundation for skin health, because with proper exfoliation, you're limiting the effectiveness of every other step that follows. This is where you start to refine the skin in a really controlled way, improving texture, brightening without even overworking the skin.
So what we're doing clinically is increasing cell turnover, we're improving permeability, enhancing absorption, so everything that follows works more effectively. So we customize this based on the patient. There's an 80 grit for your thicker, more resilient skin. There's 100 grit for standard treatments, 120 or standard treatments, but also more your normal combination skin. And then we have the 120 grit for more sensitive skin. So it's not a one size fits all. We're really able to tailor our treatment to the patient.
And this next step tends to surprise people. It did me. Hydrogen water. Because when patients hear water, they think, okay, what can we really expect from this?
That's where we're shifting from exfoliation now into protection. So hydrogen is the smallest molecule in the universe. So it can penetrate far deeper than your traditional antioxidants. So it's neutralizing free radicals, so those unstable molecules. And when we have patients that come to our practices in our clinics, often they're coming for these skin conditions, but what's driving those conditions often is these unstable molecules, right? They're causing inflammation, aging, cellular damage. And then what's unique about this particular technology within the Bela is that it converts them into water. So, and then the body can safely remove them, but also provide that additional hydration.
So we're not just hydrating the skin, we're actively reducing the oxidative stress.
And this is where it becomes, again, that powerful antioxidant protection. Deep hydration reduces inflammation, stronger, more resilient skin. So it isn't just about hydration. It's now having the ability to offer protection at that cellular level.
Okay, this is the part everyone really loves. And it's not even a secret at this point. I'm obsessed, but maybe not during lunch.
Hopefully nobody's eating.
I love it. Hopefully no one's eating, but if you're a real esthetician, you know you love this, okay? It gives so much immediate gratification, but it's also gentle. You're clearing the pores, you're removing buildup, and refining texture without causing trauma to the skin.
And that's what makes this step so effective as well. So you're using these ultrasonic vibrations here, and they vibrate at around 2,000 to 3,000 microvibrations per second. So it's vibrating really fast, that it helps to lift up the debris and the impurities out of the pores.
And it's definitely helpful for those stubborn areas around the nose, and to be honest, anywhere in the T-zone.
And what many providers don't realize as well is that this device does offer a second function. When you turn it over, we now have sonophoresis on the other side.
Which is where it becomes really more than just a cleansing tool, right?
Exactly. So when I was saying, as you flip the spatula over and you have it more flat against the skin, this helps to increase skin permeability. So when you're looking to enhance penetration of serums that are applied, so we actually get up to 3,000 times more penetration than those passive applications.
Which is making this a really strong add-on for all clinics. No
Mhm.
consumable, easy to integrate, and it enhances whatever treatment you're pairing it with.
And that's where Bella goes beyond just a protocol. It becomes a platform that drives results and revenue.
Now we move on to one of the more well-known technologies, microcurrent. And if I've ever been on the phone with a customer, I bring that back and say, all things in aesthetics become new again. And microcurrent, we're seeing a major uptick. This is a step where patients really feel like the treatment's working.
It delivers this low electrical current, right, that mimics the body's natural bioelectrical signals.
I always describe it as a workout for the skin, right? Because when you're activating the muscles underneath, it's not only helping that, but the surface as well.
Exactly. And from a clinical standpoint, we really are here also stimulating circulation. We're increasing oxygenation. We're enhancing lymphatic drainage, activating those facial muscles. So, just like you said, we're not just treating the skin, now we're influencing the structure. And it is kind of that workout for the skin.
And honestly, you can really see the lift and contour happening in real time. So that involuntary muscle movement, patients can see it, feel it. It's really quite an experience. Patients love it.
They do love it. They often express to me like they feel like something is happening, something's working, contact's been made, right? And often they're giggling through this part of the treatment too, because there's these involuntary muscle contractions around the mouth that's kind of flickering, around the eyes. We're getting all these little contractions and things that are happening. But the key thing here is something is happening. Also, no downtime and really not uncomfortable for the patients too.
So now we're moving on. We're done with the work, the prep, the exfoliation, detox, hydration, and stimulation. At this point, the skin isn't just prepped, it's really optimized. And I love that word, optimized. So now we're really ready to deliver results.
Yeah, and where a lot of treatments tend to fall short is because an infusion system really is only as good as what you're actually delivering into the skin.
And that's something that patients don't really recognize. They assume
Mhm.
all infusion systems are the same, but the serum quality delivery is everything.
100%. You're only as good as what you're infusing. And that's why our bioinfusion serums are designed to do three things: to penetrate deeply, to target specific skin concerns, and deliver long term skin health. So it's not just that temporary surface, superficial hydration.
So instead of just getting a glow for the day, we're actually improving the skin over time.
And this is where we really start to see that shift from treatment to transformation. So the patients get up from the treatment bed and they feel that hydration, they look that dewy look that everybody's kind of looking for, that instant gratification. But I don't know if you agree, Mary, over time, don't you find patients are like, oh, even day 3, I looked better. There's this consistent improvement into the skin as they
Absolutely.
have from the treatment, right?
Absolutely.
So, how do we take it a step further? What makes our system or our serums so unique is this niasomal delivery. So, most people have heard of liposomes. We use niasomal. So, we actually have the ability to carry both lipid based and water based ingredients into the skin. So, what you want to think about with these is this tiny little microscopic carrier that takes these active ingredients exactly where they need to go.
So instead of a product just sitting on the surface,
We're not sitting on the skin. We're working inside, really actually working down closer to that cellular level. And this is where we take it even a step further. So we've delivered these niasomes into the skin. We've prepped the skin with all the previous hand pieces. And now we're going to introduce the electroporation. So we actually create these temporary pathways at this cellular level, allowing ingredients to penetrate more effectively.
and it also drives those ingredients deeper into those layers so that we're seeing change in the skin, whether it's acne, calming for
Mhm.
rosacea, brightening, or overall hydrating. This is really helping to improve the treatment overall.
Exactly. So these serums go exactly where they're meant to go. So it's not just sitting in the extracellular matrix. We now actually have a direct effect on the cells. So what you just mentioned there, redness, pigmentation of the skin, we actually have the ability to kind of work with those cascades, inflammatory and the pigment cascade, right? The melanogenesis cascade. So those channels open up, they deliver, and then they close, locking everything inside.
And it's not just better absorption at this point.
It's targeted delivery with lasting impact. And that's how we again move from this surface level skincare to a cellular level change. And at the end of the day, everything we talked about comes back to one thing, and that's skin health. Because when the skin is properly prepared, hydrated, and supported at a cellular level, fibroblast functions better, collagen production improves, and the skin responds more effectively to every treatment that follows.
And we see that every day in the clinic. When the skin is hydrated and functioning properly, you're getting better treatment outcomes, faster recovery, and more consistent and predictable results.
Exactly. And this is especially important when you are working with energy-based treatments, even with microneedling, whether it's got RF or not, because better hydration directly impacts how the skin absorbs energy, how it remodels collagen, how it heals. And if the skin is optimized, that word that you love, Mary, you're limiting your results if your skin is not optimized. Sorry. So we love that word. You're limiting your results before you even begin introducing these more corrective treatments. Mm-hmm. So Bela MD wasn't designed as just another skin health or infusion treatment. It was built to prepare the skin. It was built to strengthen the skin and make every other treatment perform better. So it's an add-on. It's not just an add-on. It's the foundation.
And that's the difference we see in the clinic. When the skin is properly prepared, everything works better, results are stronger, healing is faster, and outcomes are more predictable.
I think Bela should be kind of like the workhorse within a practice, right? When you're doing consults and you have these patients come in, the skin's dry, dehydrated. I mean, look where we live. I mean, I live in Canada. It's really cold here. So we're in and out of these cold fluctuations, getting blasted by heat when you walk into Walmart, which really takes a toll on the skin. So every patient that walks through a practice is in need of hydration. So prior to doing those energy-based device treatments or microneedling or even injectables, we need to have a well-hydrated environment, right? Because great treatments don't just start with the device, they start with skin. And that's really what Bela is about. It's creating that healthier skin that responds better to everything.
Absolutely. So whether you're integrating it into an existing treatment, using it in your standalone, or it really becomes a key part of your practice to consistently deliver elevated results.
Mm-hmm. Well, that's it for us today. So thanks so much for spending the time with us in the LUVO Lounge. We really do appreciate you being here.
And hopefully this gave you a different way to think about how you can approach your skin and treatment outcomes.
And we're looking forward to seeing you on the next episode.